Hey everyone, and welcome. Today we're diving into the really powerful and, honestly, fascinating world of psychiatry. Here in the US, millions of people are turning to this field of medicine, not just to get by, but to truly live better lives. So let's break down what that actually means.
Just let that sink in for a second. This question right here is really at the core of what modern psychiatry is all about. It completely reframes mental health, taking it from this abstract, kind of hidden thing to what it really is, a vital part of your overall physical health.
All right, so let's start with the absolute basics. To really get a handle on mental wellness, we first have to nail down what psychiatry is and, what makes it so unique in the world of medicine.
The key phrase to grab onto here is right in the definition. It's a branch of medicine. See, psychiatrists aren't just there to listen, they're medical specialists. They understand the incredibly complex links between our brain, our body, and how we act.
And this brings us to something that can be a little confusing for people. A psychiatrist is a medical doctor, an MD or a DO. This is a huge distinction because it means they have the unique ability to prescribe medication and order lab tests. They can blend those biological treatments with talk therapy in a way that other mental health professionals just can't.
And having that medical background is absolutely critical because mental health conditions are not some kind of personal failure, not at all. They're complex issues that are tied to very real, tangible things, like your brain chemistry, your family genetics, past trauma, and even your day-to-day lifestyle. Psychiatry is the field that really connects all those dots.
Okay, so now let's zoom out a bit and look at the bigger picture here in the US. The numbers might seem a little staggering, but they also tell a pretty hopeful story about how we're getting so much better at talking about this stuff and getting help.
Nearly 1 in every 5 adults in the U.S. deals with a mental illness each year. I mean, that is tens of millions of people. This isn't some rare thing affecting a handful of people. It's a common part of life for our friends, our family, our coworkers, and maybe even for ourselves.
And if we break it down, we can see some of the biggest challenges we're facing. Anxiety disorders, they're the most common. And depression, it's not just feeling down. It's a leading cause of disability across the entire globe. You can see how these conditions have a massive ripple effect on everything.
So let's just quickly glance at a few of these. You've got the persistent low energy of depression, the constant worry that comes with anxiety, the wild mood swings of bipolar disorder. Each one looks different, sure, but the single most important thing to remember is that every single one of them is treatable. So how does that treatment actually work? What happens when you go for help? Let's open up the psychiatrist toolkit and demystify the whole process. It's way more structured and personalized than you probably think.
You know, the journey to feeling better follows a really clear roadmap. It all starts with a super detailed evaluation, which then leads to a proper diagnosis. From there, the psychiatrist builds a treatment plan that is 100% tailored to you. And they're with you every step of the way, checking in and adjusting things as you go.
And that treatment plan, it's usually built on these 4 pillars. It's almost never just about one thing, because treatment isn't one size fits all. Sure, medication is a powerful tool, but it's often part of a bigger puzzle that includes talk therapy, making key lifestyle changes, and sometimes even more advanced options. It's a whole-person approach. So what does that look like in the real world? Well, medications like antidepressants can help rebalance the chemistry in your brain. Then there's psychotherapy like CBT, which is amazing for helping you spot negative thought patterns and learn new ways to cope. But it also includes the basics like sleep and exercise, alongside really cutting-edge treatments like ketamine therapy, which is offering brand new hope for severe depression. And that brings us to our final section, which is honestly the most hopeful part of this whole story. We are in the middle of a massive shift in how we think about mental health, and it's all being powered by new technology and, well, just being more willing to talk.
Technology has been a total game changer here. Telepsychiatry means you can talk to a doctor from your own couch. Mental health apps put support right in your pocket. These tools are tearing down old barriers and making quality care easier to get than it has ever been before.
And as it gets easier to access help, our attitudes are changing too. I mean, we've gone from an era where mental illness was something to be ashamed of and hidden, to today where you see celebrities and regular people on social media opening up the conversation. The future we're heading towards is one where getting mental health support is just a normal part of life, at school, at work, everywhere.
This says it all, doesn't it? The entire story has flipped. Realizing you need support and then actually taking that step to get it, that's one of the strongest and bravest things anyone can do.
If you only remember one thing from all of this, please let it be this.
No matter how tough things might feel, there are real, effective ways to move forward. Hope isn't just a nice idea, it's a real strategy for recovery. Seriously, never forget this. Taking care of your mind isn't a luxury, it's a fundamental need. It's the foundation for everything else in your life. It really, truly matters.